Hello everyone, welcome back. Feel free to introduce yourself in the chat box, let us know where you're joining us from today. I'll be very quick with a little intro, but for this session we're joined by digital consultant Beth Granter, who is going to talk us through the process of designing Wellbeing of Women's Period Symptom Checker in collaboration with GPs, gynaecologists, researchers and women with menstrual health conditions. Now, before handing over, I just wanted to share a few house rules and pointers for today's session for those who are just joining us. The session is being recorded and will be uploaded to watch on demand at a later date. The slides and other resources will also be made available to you, so don't worry if you've missed anything. During the webinar, please ask questions in the Q&A section to address at the end of the presentation, and feel free to share any other comments, experiences or top tips in the chat section. Finally, if you encounter any sound or image issues, please let us know in the chat and we'll do our very best to get everything back to normal as soon as we can. Now, that whistle-stop tour's done. So without further ado, let me hand over to Beth.
Hi, everyone. My name is Beth Granter and I help nonprofits with digital strategy, digital transformation and advocacy campaigns. And I've been doing this for 20 years. Some of the nonprofit clients that I've worked with include Oxfam, PETA, RSPCA, the National Housing Federation, Terence Higgins Trust, BBC and Mind. But I'm here to talk about Wellbeing of Women. So I've worked with Wellbeing of Women across a whole digital transformation programme and multiple campaigns over the past 4 years. Wellbeing of Women are the women's health charity saving and changing the lives of women, girls and babies since 1964. Their mission is, led by women's voices, we improve health and well-being through research, education and advocacy. So on to the Period Symptom Checker. First, I'm going to show you a video of what the Period Symptom Checker is, and then I'll go right back to the beginning of the idea. The Period Symptom Checker is a browser-based app. It's built in type form, and it asks a series of questions about your periods. It takes about 2 minutes to complete, and it asks about your symptoms and how your periods affect your life. It asks how bad it is, what have you already tried, what areas hurt, words to describe your pain. And you can get your results via email if you want to. Either way, you'll get your results in the browser and it will give you advice, possibly telling you to go and see your GP if appropriate. It'll tell you about different conditions and it will even give you a PDF that you can print out and take with you to your GP appointment. So what is human-centered design? You might have heard lots of people talking about it in recent years. I actually came across it fairly recently as a phrase, but what I discovered was that I'd actually already been doing it for many years, so you might already be doing it without realising it. And it was this approach that I used to develop the Period Symptom Checker. So what is human-centered design? It's an approach to product or service design where you design around the needs of all the different people impacted by a product or service. So the core user needs are still at the core of it, but it involves thinking about who else would also be impacted as well. So when it came to the Period Symptom Checker, we also needed to consider the needs of GPs, for example, even though they wouldn't be using the tool themselves. So user needs and experiences can be understood best through immersion and observation. And it's also important to consider societal issues and context. So, for example, there's things like long gynecological waiting lists, short GP appointments, and equalities issues, barriers to underrepresented groups. And human-centered design includes an understanding of competitors and the whole sector, and also consideration of the whole user journey. So not just while people are using or interacting with your product or service, but how did they get there in their whole life and what happens next? And prototyping is a handy tool to test and get early feedback in the development process. And also human-centered design includes the principle of co-design, which means collaborating with your users to define what the product is. So where did it all begin? In August 2022, the UK government published the first women's health strategy for England. They surveyed thousands of women and found that 63% picked gynecological conditions for inclusion in the strategy. That was their top issue. And 47% picked menstrual health. That was the fourth top issue. And of course, there's a lot of overlap between what is a gynecological condition and what's a menstrual health issue. For example, when it comes to something like endometriosis. The Women's Health Strategy identified key menstrual health issues: a lack of access to information, normalization or dismissal of pain by doctors, diagnosis delays due to a lack of education of healthcare professionals and poor service provision, period poverty, and period stigma. At the same time, we knew from research that endometriosis affects 1 in 10 women, so it's not a rare condition, it's very common, and time to get a diagnosis was averaging 7 to 8 years. So with this insight, Wellbeing of Women realised that they needed to campaign for better menstrual health. And they brought me in to create the campaign strategy. So I started off with desk research. And one of the first things that I did was to look at search trends and do social media listening. Using Google Trends, I looked at how much people were searching for key menstrual health conditions and how they all compared. So Google Trends is able to collate different phrases, different searches that are basically saying the same thing with the same meaning, even though they're using different words, into combined conditions or diseases, disorders, and topics. So, for example, the blue line here, it says dysmenorrhea, which actually means period pain. Now, most people won't know what that word means, so they won't actually be typing in dysmenorrhea, but Google will be combining searches about period cramps and period pain, etc., under this condition. So it's a helpful tool to bring together the multiple different search terms into one data set. And the fact that on this chart, the yellow line, menorrhagia, which means heavy periods, was the lowest, that didn't mean that it wasn't important. First of all, it was on the chart at all. If there's enough data to be on the chart, then it's pretty important. And it also, with the social context of stigma around period blood and normalization, we had to consider that those things, those societal things, could be affecting people's search habits. And I also used tools like SEMrush to look at what the related search terms were around periods. What words were people searching for? And you can see that irregular periods and heavy periods featured here. So it was useful to use more than one source of data. Then I looked at Twitter conversations about periods across a whole year. On the right is a Boolean query that I wrote, and that includes phrases like my period and period problems, as well as specific gynecological conditions. And I limited it to the UK, which was particularly important, not just because our target audience was in the UK, but because Americans using the word period to mean full stop would have been quite difficult to work around. And I also excluded organisations because I didn't want campaigns or product marketing to skew the data. I wanted to hear the conversations of real people. And I also limited it to original tweets, not quote tweets, so that an influential person or a viral tweet wouldn't be overrepresented. And I used Meltwater to do this. But there's lots of different social listening tools that you can use. So this is the full query word cloud, which covered 22,000 tweets. And then I filtered it into different topics. So when I looked at what people were saying around heavy bleeding, the insight here was that home and house came up. The conversations about home were about being sent home, meaning being dismissed by doctors, and also staying home to avoid flooding in public. And house is also about not leaving the house because of their period. So it's really showing us an insight into the impact on people's lives. And then I did the same for period pain. And I also did desk research of clinical guidelines, including the NICE guidelines for heavy menstrual bleeding, fibroids, and endometriosis, etc. I looked at the Royal College of GPs menstrual health toolkit and NHS Scotland's women's health web pages. The reason we use the Scottish one is because at the time, it's since changed, but at the time, NHS England's web pages normalised period pain. And Wellbeing of Women also carried out medical expert interviews. They spoke to GPs, gynaecologists, and menstrual health researchers who told us that information and education on pain management was needed. Women were ending up in A&E due to not taking over-the-counter painkillers or taking them too late. And there was a need to destigmatise painkillers and the contraceptive pill, particularly the latter for girls, because some parents were wrongly thinking that it would encourage sex. Heavy menstrual bleeding also came up as a key group of patients, particularly because heavy bleeding was risking anemia for them. And there's also a lack of education about what level of pain and bleeding is normal or not. So you're not supposed to be able to read the detail here, but this is just to show you that we also used as an input research by Sharon Dixon, and she had interviewed GPs about the reasons for endometriosis diagnosis delay. And that revealed a whole bunch of causes of the issue, from the GP level to structural and community issues, as well as issues specific to the condition. So, as user experience is core to human-centered design, understanding the patient experience and journey was really important. So I used my own personal experience of having endometriosis and adenomyosis to inform the project. I had 20 years of agonising and debilitating pain before I got my diagnosis. Family and friends had told me that period pain was normal, and there were no issues shown on ultrasounds, and period pain was my only symptom. So I'd been dismissed with painkillers, but years of pain followed. I learned about endometriosis through friends, and then I demanded a laparoscopy after my IVF failed. And finally, endometriosis and adenomyosis was diagnosed, and my endometriosis growth were removed. So that story just really informed my work on the project. And to understand more about patient experience and the prevalence of suffering, Wellbeing of Women carried out a nationally representative survey, and they found that 59% of women and girls aged 16 to 40 experienced severe period pain, and 49% experienced severe heavy bleeding. So this allowed me to map the journey of a person with period pain or heavy bleeding to identify barriers and intervention points. So it starts on the left with somebody's first heavy or painful period, which might come before or after school PSHE lessons, where they might get dismissed as normal, and they might speak to nobody because of the stigma and take no action, or they might speak to their family and friends or social media or look online, and all of that might dismiss it as normal. And if they make it to their GP might dismiss it as normal. The gynaecologist might dismiss it as normal, but hopefully, if they can overcome all of these barriers, they can get surgery or scans, diagnosis, treatment, and medication. The next step was to map existing campaigns and resources. Again, you're not supposed to be able to read the detail in the chart here. This is just to show you what I did. Essentially, I mapped the campaigns and the organisations against the key areas and found that over 19 organisations were already producing UK period information and education, and yet the public and the doctors were still underinformed. Again, the pain and heavy bleeding campaigns were often short term or led by corporates, or they had an inaccessible format. And for example, some of them may be assumed an awareness of a particular gynecological condition. So they were targeted at people further on in their journey, whereas we wanted to help people right at the start of their journey before diagnosis. So I made a little infographic to illustrate the number of organisations working in each area. And then it came to creating the campaign. We worked with Lark Creative Agency to come up with the Just a Period campaign name and creative. And we used crowdsourced social media words in the background of images. So the campaign statement was, millions of women, girls, and people who menstruate suffer with severe period pain and heavy bleeding that disrupts their lives. Instead of getting the treatment and support that they desperately need, they're often dismissed and told it's just a period. This is unacceptable. Nobody should suffer from period symptoms holding them back. And the campaign objectives were for faster access to treatment for gynecological conditions that cause pain or heavy bleeding, improved self-management of period pain and heavy bleeding, and improved menstrual health education and removal of period stigma across society. So I led an ideas brainstorm and then prioritization workshop with the team. And we brainstormed ideas and then considered how much impact they could have and how feasible they were to deliver. Some of this I've hidden as confidential because they're either ideas that Wellbeing of Women decided not to go ahead with or they're yet to launch. But you can see there that having a menstrual health online information hub is something they've done, videos for social media, a live event to launch it, and the interactive symptom checker tool, and also the NHS updated their website. The next stage was to create a minimum viable product. So what is an MVP? An MVP must be viable. So if the goal is to get from A to B, a wheel isn't going to do it at all, but a skateboard is. It might not look like or be part of the end product, but it shows the purpose. So I built an MVP for the Period Symptom Checker in type form with just 3 health-related questions. And I used that in the co-creation workshop. So the Wellbeing of Women team convened a co-design workshop inviting women with personal experience of menstrual health conditions, GPs, gynaecologists, and menstrual health researchers. And in the workshop, we gathered the needs from all the parties, deeply discussing what would be helpful, what would make women feel heard, and what information was essential to GPs. And this allowed us to capture a broad range of ideas. First, we set the scene, sharing the insights from the campaign research, strategy, and objectives, and highlighting the problems surrounding menstrual health. And then we shared existing resources and other symptom checkers and asked the workshop participants to critique them. So there were NHS web pages, other charity web pages, and then NHS decision maker tools, which were usually PDFs like this one, which is called Making a Decision About Managing Heavy Periods. And we looked at Crohn's and colitis' symptom checker. We also, outside of the workshop, had some really helpful conversations with their team. Their checker is simple, it's short, and it uses straightforward language, and it was a really helpful proof of concept for us. And there was the Day Period Pain Clinic tool. They are a private company that sell period products and related services. And the reason that this didn't already fill the gap is that their tool kind of leads people to for-profit private health consultations that are advised as the next step that people should take, which is obviously not accessible to everybody. So we talked about all of the different challenges around menstrual health, such as a lack of education, dismissal of pain, and period stigma. I won't read all of those out, but there's a long list of issues, basically. And then We asked the workshop participants to do an exercise where they answered whether each issue could be helped by a period symptom checker or not. So they voted yes or no on each challenge. And the purpose of this exercise was to embed the idea that one tool doesn't need to solve every issue. And so to prevent people saying, but it doesn't fix X problem as a blocker to progress. So an example is that the checker could help to educate women and girls, but it can't solve the issue that it's difficult to get a GP appointment, but it's still worth doing. And we asked participants to discuss how the tool could help them and help others. And they explained that a GP letter could help them to avoid dismissal. And GPs felt that it could help to streamline or focus their conversations in appointments. And then we asked the participants to rank the things that the tool could help with and to prioritise its goals. And we also wanted to discuss the scope of the tool, so what symptoms the tool would cover. So we, with the help of the workshop participants, created a long list of possible symptoms, and then we discussed what the challenges might be around how to implement some of them. And we also asked them directly what questions the checker should ask and how many. And this was actually a really helpful exercise because it showed me that my assumptions going into it were incorrect. So coming from a digital UX perspective, I'd assumed that the fewer questions, the better, for maximum conversion rate. However, people in the workshop told us that they wouldn't trust a tool if it didn't ask enough questions. So lots of questions meant that they'd be more likely to trust the advice. We also asked GPs what was crucial information, excuse me, that women could provide to help them and treat them, and how we could help them to avoid women being dismissed, and also what information would not be needed. So we weren't only adding things, but we knew what we could remove if we needed to. So the MVP that I initially built only had 2 endpoints. The real symptom checker has many more, and we discussed in the workshop what the advice should contain, how to inform without causing alarm, and what format people would want the advice to take. For example, an email or results in a web browser or a PDF. And then it was just implementing the feedback and launch. So after the workshop, Wellbeing of Women wrote up the insights. I built the MVP version 2. That was shared with the Royal College of GPs for feedback. It was reshared with the workshop participants, was tested with the Wellbeing of Women team, final amends, and then launched. And then the aim is that there will be ongoing evaluation and adaptation. So what impact did it have? 16,000 people used it in its first 8 weeks, which I was really happy about. And it has a 74% completion rate. And out of those that were advised to speak to their GP, 64% of those that responded to the survey said that they had spoken to their GP when we asked them 2 weeks later. And 63% of the rest said that they planned to. So I really feel that shows that it is encouraging people to seek help. So what's next? On the end screens, I installed a Hotjar feedback widget so that people can give their immediate feedback and let us know if they intend to see their GP at that point, and they can give comments. That hasn't yet been analysed, so we'll have to wait and see what the results of all of that is. But there will be more feedback gathering, more analysis and evaluation, and future development is TBC. Thank you very much. Any questions?
No, thank you very much for that. That was so interesting. We've had quite a few questions in, so I'll get started. What are some of the other social listening tools, and what process would you use to analyze the data that you get from those?
There are loads, and every time I come up to a social listening tool, I re-audit what the tools available on the market are, because there's always new ones coming out or companies merging and things. One of my favourites has always been Brandwatch. but it is quite expensive. So it depends on the size of your charity whether that's accessible or not. But yeah, Meltwater was just one that Wellbeing of Women managed to get quite a good deal on. So that's basically why we went with that, but it's not as user friendly as something like Brandwatch. And the process to using it would be some of the search insight work really helped me to have a look at like what are related keywords, because if people are searching for something, they might also be talking about it. Um, uh, and just brainstorming around the topic. And once you start doing putting words in, you'll see all the conversations and be like, oh yeah, I want more on that. And it's a bit of a like iteration and building it up.
Brilliant, thank you. Yeah, we love a keyword search. That's big fans in the content team. How long did the whole project take?
Um, Now let me think. It feels like about a year, but I don't know. I can't tell you exactly. It might be 8 months. It might be a year, something like that. But it was at least 8 months. And yeah, it was longer than we thought before we started. But when we talked to other people that had built similar tools, they told us to expect that. So we didn't feel too bad. That's how long it took.
Was it easy to keep momentum up for the project?
Um, Not really. It was. I think that the most challenging thing was there was lots of people's input that we wanted to get, and it was just
Yeah.
the admin of scheduling diaries and finding time for people to get together. It's not that it took that long to do the practical building bit. That
Mm,
didn't take that long. It was the admin and coordinating all of the different people.
thank you. Did you develop the app in-house or did you reach out to a third-party developer who built it based on your wants?
Well, I'm freelance, and I built it in Typeform. And the reason that we did that is because it was cheaper than just building something from scratch, because what we wanted to do was quite complex.
Mm,
And there's lots of like complicated. If it was just like a simple ask these questions, give us the answer, then we might have wanted to do something custom. But there's a lot of complicated logic on if you ask this question, then ask this question next. So you get
yeah.
asked different things. And Typeform kind of already had all of that set up. And also, other organisations that we spoke to had already used Typeform for a similar thing. So
Mm,
we knew it would work.
great.
And also, I could build it without being a developer.
That's very helpful. Um, especially, when trying these things out and yeah, it's been very useful. Thank you. This is quite a broad question, but looking at it from the other side, where could we begin to look into and change the education of healthcare professionals to include these conditions?
That was a massive question in the
Mm,
whole strategy. I don't feel like I'm in a position to speak to that because it's just like
mm,
such a massive societal change thing. And we ended up not focusing on that as part of this campaign for now. They might decide to include that more in the future, but for now it was around tools to help women to advocate for themselves. And hopefully, if they are taking that letter with them to their GP, then that will kind of educate any GPs that need to be educated about these things. But there is so much to be done that that would be like a whole campaign in itself. Yeah.
definitely. Thank you. And just a final question. What sort of goes into an idea prioritization workshop? Because it sounds like a very complex.
Oh, it's not complex, really. I mean, it's just like your normal brainstorm of everyone coming up with ideas of everything you could possibly do, and then the scales are like how easy is it to do and how likely are we going to be able to achieve it, and against how much impact it's going to have. So it's just a judgment call, really, like going, where should we put this, and everyone going right a bit, left a bit, sort of thing, until everyone sort of feels like it makes sense. And then you can kind of see in the top right are things that are going to be easy or possible
Mm.
and have high impact. And those are the ones that you're going to want to do first.
Brilliant, thank you. To help you see the wood from the trees.
Yeah.
Yeah, thank you so much. That's been a really great session. Thank you for joining us and telling us all about the app. It's really interesting to hear.
Thanks
Thank
very
you.
much.
And thank you everyone for joining us. Please stick around for the next session. I think it's due to start very shortly. Yeah, thank you, Beth.